For this project, I wanted to raise more awareness about multiple sclerosis. I hope you enjoy. What is MS? MS is a chronic, typically progressive disease that involves an abnormal immune system-related response. What happens is that the T cells of the body's immune system leave the bloodstream and seep into the CNS. The CNS is the central nervous system, which includes the brain, spinal cord, and optic nerves. Once the T cells enter the CNS, they slowly attack the body's central nervous system. This causes inflammation within the CNS, which damages the nerve cells. Specifically, the T cells slowly destroy the myelin sheath encasing the nerve. What is the myelin sheath? Think of an electrical wire. The actual wire itself is your nerve cell, and the rubber casing around it is like the myelin sheath. Therefore, the myelin sheath is a fatty substance that surrounds and insulates the nerve fibers. Sheath is responsible for protecting the nerve and increasing conduction velocity, which is the speed at which sensory information picked up from things you hear, see, touch, taste, and smell are delivered to your brain and are processed. With multiple sclerosis, this myelin sheath is damaged or destroyed, which causes the messages within the CNS to be altered or even stop completely. Scars developed in these damaged areas, which gives this disease its name. Multiple areas of scarring equals multiple sclerosis. Because the central nervous system starts to not function properly as a result of this disease, the whole body starts to break down. At first, numbness, fatigue, dizziness are common symptoms that are felt by the patient. As time goes on and this disease progresses, tremors, slurred speech, and loss of vision become more and more prevalent. Eventually, this disease destroys so much of the nervous system that the person starts to lose balance, function, feeling in their arms and legs, and start to develop different diseases, including osteoporosis, which is bone thinning, and even changes in their overall mental status. Most individuals with MS become bedridden before they pass away because they no longer have sensation or control in almost every part of their body. As of right now, it is not known what causes multiple sclerosis to occur, but doctors have been able to gather factors that may increase your risk for developing MS. Some of the most common factors include the following. Age. MS most commonly affects people between the ages of 15 and 60. Sex. Women are twice as likely to develop MS as men. Family history. If one of your parents or siblings has or had MS, you are at a higher risk of having it too. Race. People from European descent typically have the highest risk, while Asian, African, and Native American descents have the lowest risk. Certain autoimmune disease. If your immune system is already compromised, you are at a higher risk of getting an immune-related disease as well. MS has been seen most prevalent in people who already have thyroid disease, type 1 diabetes, or inflammatory bowel disease. And of course, smoking, alcohol, and drug-related use increase your chances of getting MS drastically. These are one of the only modifiable risk factors with this disease as well. Currently, there is no known cure for MS. Treatment typically focuses on speeding recovery from attacks, slowing the progression of the disease, and managing MS symptoms. Today, there is only an injection option for medication specifically for MS patients. There are no oral pills developed yet. The injection option is almost like an EpiPen that they have to inject into themselves 2 to 3 times per week, depending on the stage of the disease. These have been reported to help with symptoms and slow the progression of the disease. However, they also have been shown to have really horrible side effects, including severe bruising and flu-like symptoms after taking the medication. Studies have shown that using other forms of treatment can help alleviate some of the symptoms associated with this disease as well. These include doing chemotherapy, taking anti-inflammatory or immunosuppressive drugs, and even steroids. Other therapies include counseling, physical therapy, and acupuncture to keep individuals physically active and as strong as possible as the disease runs its course. Some people have such mild symptoms that no treatment is necessary, and others need a combination of the above methods in order to feel any relief from their symptoms. This disease is life-changing and extremely destructive. There are many people who have found relief and have been incredibly successful despite this setback, but more awareness and support is definitely needed. Make sure to give your support to those who are currently suffering with this disease and spread awareness to those who do not know this condition exists. For any additional questions, please visit these websites. They have an incredible amount of information about this disease and how you can potentially support. Thank you all for listening. I hope you all enjoyed.